Language is more than just words. It's a bridge that connects us, allowing us to understand and be understood. But when language barriers arise in healthcare settings, that bridge can become a barrier, creating significant challenges for both patients and healthcare providers. Imagine this. You're in a hospital feeling scared and vulnerable because you're not feeling well. Now, imagine trying to communicate with your healthcare provider, but they don't speak your language. It's frustrating, right? You might not be able to fully explain your symptoms, understand your diagnosis, or follow the treatment plan. That's the reality for millions of people around the world who face language barriers in healthcare every day. Language barriers can have a profound impact on patient care. They can lead to misunderstandings, misdiagnoses, and even medical errors. Patients may feel anxious, confused, or isolated, making it harder for them to engage in their own care and advocate for themselves. But it's not just about communication, it's also about culture. Language is deeply intertwined with culture, and when patients can't communicate in their native language, they may feel like their cultural beliefs and values are being overlooked or dismissed. This can erode trust between patients and providers, making it harder to build meaningful therapeutic relationships. Healthcare providers also face challenges when language barriers are present. They may struggle to accurately assess patients' needs, provide appropriate care, or obtain informed consent. It can be frustrating and time-consuming to work through interpreters or language translation services, especially in fast-paced healthcare environments. So what can we do to address language barriers and improve patient care? First and foremost, we need to prioritize language access services. That means providing trained interpreters, translated materials, and language assistance programs to help patients communicate effectively with their healthcare providers. Cultural competence training is also essential. Healthcare providers need to understand how language, culture, and health beliefs intersect, and how they can provide culturally sensitive care to patients from diverse linguistic backgrounds. But perhaps most importantly, we need to listen. We need to listen to our patients, hear their concerns, and respect their language and cultural preferences. By creating an environment where patients feel valued and understood, we can break down language barriers and improve the quality of care for everyone. So let's commit to breaking down language barriers in healthcare and building bridges of communication and understanding. Because when we can truly connect with our patients, we can provide the compassionate, patient-centered care they deserve.